promote information on prevention, treatment, survivorship, and cure, and resources related to cervical cancer. Also, Happy New Year to everyone. I know this is our first meeting of the new year. And for those who are 49ers fans, go Niners, right? So, with that, a little bit about the Cancer Campaign Network. We are going into our fourth year as a network, meeting and collaborating and connecting around the various cancer campaign topics. Again, this month is Cervical Cancer Awareness Month. We will reconvene again in March for Colorectal Cancer Awareness Month and Multiple Myeloma Month. And then April, Minority Health, Cancer Control Month, Head and Neck Cancers Month. May, excuse me, May being Skin Cancer Awareness Month, June, Men's Health and Cancer Survivorship, September, Prostate Cancer and Blood Cancers Awareness Month, October, Breast Cancer Awareness Month, and November, Lung Cancer Awareness Month. So together in our meetings, we come together to promote ways to lower cancer risk, and where it is possible or accessible, we promote regular cancer screening. We also have education segments, and we also try to engage and support each other who are doing cancer education and awareness activities. We also share key messages and actions that can be taken and facilitate networking and linkages to care and resources. So that's just a brief overview about our Cancer Campaigns Network. Again, thank you for joining us. And if you have not had an opportunity to do so, we ask that you go ahead and introduce yourself in the chat with your name and organization so that others can reach out to you, or you can reach out to others to help facilitate that further networking. So I'm going to ask if our guest, Mr. Robert Park with the American Cancer Society, if Robert has been able to log in yet, because from the view I'm looking at, I cannot tell that. So,
right here.
Okay, great. Do I need to stop sharing?
I don't have any
Okay,
visuals, so yeah,
well,
whatever you're comfortable with.
we'll go
Great.
ahead. Thank you so much for being here and for sharing, and thank you to our partner, Murnell Gomez, for introducing us to you and inviting you to share with us. Go ahead, Robert. The floor is yours.
Good morning. Thanks so much for having me. So my name is Robert Park. I'm the Government Relations Director. I'm actually based out in Los Angeles, but helping provide this federal update on what everyone is focused on, which is the ACA subsidies, which matters so much for cancer patients. So there's a lot going on in the news. So brace with me as I kind of give a high level overview of what's going on in DC. So for more than 2 years, ACS-CAN has been urging both parties in Congress to come together to extend these subsidies to ensure that millions of Americans don't lose access to affordable health insurance. We know that if people can't afford coverage, it will delay potentially life-saving cancer screenings, detection, and treatment, which puts your lives on the line. And I want to preface by saying that everything is very fluid at the moment. Nothing is official. The Senate is being very tight-lipped, so I'm really relying on insider information from my colleagues in DC. So late last week, we were pleasantly surprised that the House in Congress, they passed the bill to extend for 3 years these subsidies. And now this bill is moving to the Senate for consideration. And this matters really a lot right now because about 22 million Americans are directly impacted. These premiums have already gone up in 2026, and average monthly premiums are more than doubling this year. The average is about from $74 a month to about $160 per month. So it's more than doubling. And a lot of analysts are projecting that about 5 million people could lose their coverage and become uninsured. In California, in particular, about 1.7 million covered California enrollees are already seeing cost increases. In terms of the political dynamics, so the House passed this bill. The vote number was 230 in favor to 196 against. So every Democrat voted in favor. We were surprised to find that 17 Republicans joined Democrats, which is extremely rare in today's political climate. And this was a really strong rebuke to Speaker Johnson and Republican leadership. And these Republicans are mostly moderate centrist Republicans. A lot of them are in swing districts, which means they're vulnerable, especially in the midterm elections happening this year. So this House vote essentially forces the Senate to come back to the table. And currently, bipartisan Senate negotiations are happening. There's some general skepticism on these discussions because it's not Senate leadership negotiating, it's rank and file members. And from my knowledge, they haven't included staff, which is concerning. And there's not yet a draft bill, more so like bullet points that they have used in previous discussions. So again, everything's very fluid. We think we'll see some developments in the next few weeks and hopefully a vote coming out before, I would say, next month or so. But we'll keep you posted as we learn of anything. Um, what the Senate is considering will be more restrictive, which is very concerning to us. So the House bill is a 3-year extension. The Senate bill will be a 2-year extension, and the primary concern is the cost. The House bill will cost about $80 billion for the next 3 years. Republicans on the Senate side, some of the restrictions they're demanding are income caps on subsidies, which would really hit California hard because it would affect many self-employed people, early retirees, and cancer patients who have to work reduced hours. They want to eliminate $0 premium plans, which means everyone has to pay at least $5 per month, which doesn't sound much, but this would effectively kill automatic coverage retention. And if you miss a payment, it'll cause millions of Americans potentially to drop off. And that's kind of the strategy. They're also pushing to allow the subsidies to go into HSA accounts, health savings accounts. And this would, of course, primarily benefit higher income people and not really low income patients. So Republicans, they're currently under pressure because premiums have gone up in 2026. Voters are furious. 2026 midterm elections are extremely competitive this year, and senators in swing states are exposed to these healthcare cost criticisms, and they don't want to be blamed for the rising premiums. Something that President Trump said yesterday actually was that he may veto a bill if Congress sends one to his desk, and that's after he learned that these moderate House members voted along with Democrats, so he was upset. So even if the Senate passes it, we're concerned that the president might veto because he's just philosophically against the Affordable Care Act. So bottom line, the Senate may salvage this with a smaller, more restrictive deal, and pressure is ramping up. What ACS Canada is doing is we're in full federal rapid response mode at the moment. We're actively lobbying moderate Republican senators and especially the vulnerable senators in swing districts. We're pushing earned media, including social media campaigns, op-ed articles, and local TV interviews to keep public pressure high. Something that we encourage our coalitions and community members like yourselves to do is continue to, well, I mean, California doesn't matter too much. Our 2 senators will vote in favor, but for other states, just really mobilizing letters and calls and social media to the senators, urging action and helping them to understand that cancer patients will kind of take the hardest hit if they lose affordable coverage. So we hope to. We're crossing our fingers. We're hoping to learn better news and see the light at the end of the tunnel. I'm hoping to get more updates later this week, so we'll hope to keep you apprised as any developments rise. But that's kind of my overall summary, and I think there's some chats here, but let me know if you have any questions.
Okay, thank you so much, Robert, for that update from the American Cancer Society Cancer Action Network. And I see that your colleague Murnell is populating the chat with some additional links and information and resources. So folks, please take a look at that. And I don't see a hand raised at the moment.
Michelle, there is a question from Gary for
Oh, okay.
Robert. Yeah, I'll
Sure.
just read it out here because we have quite a few coming in the chat. So it says, are there any competitive Senate bills on the calendar which are being considered?
In regards to this vote, there's nothing scheduled at the moment. There's nothing calendared. Yeah, it's very fluid, so nothing at the moment, unfortunately. There's still active negotiations.
Thanks, Robert. That's all I see so far. And thanks for also including your information in the chat.
Thank you.
All right. Thank you again for being here.
Of course.
And people can follow up and keep abreast of the American Cancer Action Network actions and resources and information as you follow the chat, or of course, connect with Robert or Murnell for further information. So we want to thank you for being here and understand you will have to leave early. We're going to move on to the next item on our meeting agenda. Thanks again.
Thank you.
Okay, well, just let me go quickly back here to our agenda right quick for those who just came in. We have just completed our American Cancer Society Cancer Action Network update. And the next item on our agenda is we're going to hear from Jocelyn from the Survivor Organization. But before we hear from Jocelyn, I'd like to share a brief introductory video. So please pause for that.
I live my life beyond cancer by making sure I open the door and I take a step out. I always try my best to just enjoy every moment I have in life because I know that it could end at any moment. My name is Jocelyn Chypreser-Pagio. I was diagnosed at 18, and cervical cancer changed my life completely. Not only changed my present life when I was 18, but it also changed my future, having children, thinking about my future, and honestly, I'm still in the fight today. When I was 18, I literally thought I was invincible. My life barely started. I was going to college, kind of figuring out my life. And when I was diagnosed with cervical cancer, it stopped. I was bed rested for 9 months. I almost lost my daughter. You know, you don't think about those things. And that affects the rest of your life, your decisions that you make. I want young adults to realize that there's no shame in having cervical cancer. Absolutely no shame. The shame is not doing something about it. Having my surgery or hysterectomy after about 8 weeks ago, I'm still in the constant battle. Life is really precious and I can't take it for granted anymore. I need to be able to take care of myself and my family. So I do food. I enjoy cooking and taking care of my daughter, making sure that she experiences every part of life that she has, because she's also a woman and she could also be diagnosed with cervical cancer later on in life. I don't know. But this point, it makes sure that she gets to enjoy every part of it and I get to take that ride with her. The one thing I think I really want to share is that the fight is never over. Even though you think you're good and you've got clean scans and you're ready to start a new day, it's never over. You have to be conscious about your diagnosis and your lifestyle. And that has changed. You know, being diagnosed and surviving cancer will always change your life.
Okay, with that, everyone, you've had a chance to meet Jocelyn, and I will turn the floor over to Jocelyn from Survivor so you can hear more from her. Jocelyn, the floor is yours.
Thank you, Michelle, for the opportunity to be here and speak with you. And I appreciate this opportunity. As you saw in that video, I am a cervical cancer survivor. Briefly, it's kind of, as I said in the video, it's changed my life. It's been some years since I've filmed that little video, but it's still part of me to my core. So I'm here to try to share a little bit of information about Survivor, which is the organization that I partner with and I am an ambassador for. As you know, as you've heard Michelle say that, January is Cervical Cancer Awareness Month. So this is really our push to educate everyone about cervical cancer and not only the HPV vaccine, but also screenings that will help save a person's life. So I'm going to share my screen and just kind of give you a little bit of information about Survivor. Let me see, did it go through? And I'm going to, and everyone can see the screen, correct?
Yes.
Okay. So Survivor, it's a global community of patient advocates, and it's kind of unique because we started it as a grassroots organization, very small, just by our founder, Tamika Felder, who is right here in the middle. She realized that there was a gap, right? We were all diagnosed with cervical cancer. Many of us didn't even know what cervical cancer was, where our cervix was, and how were we affected. So it really got her inspired to really start this organization to really help educate patients and help them become advocates for their own health. And so really our primary mission is to empower those affected by cervical cancer through education, advocacy support, and community building. These are the core values of Survivor. So not only, as you heard, empowerment, education, advocacy, and community. And really the empowerment part is really to share our experiences. And that really empowers a patient. I mean, when you speak about your story, it really already empowers you to really voice and share that story, whether it's written or vocal. So that's part of that, real core value of Survivors. We want to empower our patients because a lot of times when you're diagnosed with cancer, that power you feel is gone. You're in a state where you're relied on everyone else and their opinions, and your voice is completely lost in that journey. So this is where we bring that power back to the patient. We also want to educate patients about cervical cancer and HIV because a lot of times we find a lot of patients are completely lack that gap in knowledge about HPV and how they our HPV is contracted, what options they have, and cervical cancer when they're diagnosed and what treatments they have. We hear a lot of patients saying, well, I never received that treatment. How come that wasn't given to me as an option? So this is where we get together and we really try to educate everyone about what options they have. Advocacy is the other core value is we want to be able in part to empower patients, also make sure that they advocate for not only themselves, but eventually for others. I got that empowerment and I made sure I got a second opinion when I was first diagnosed because a lot of the times, a lot of patients will say, well, I missed, and a lot of the symptoms that I have are missed. And so this way we try to make sure that patients are advocating for themselves and also their family or their friends and giving that the opportunity. The last part is we want to build that community. That's a really big core value to us. We refer to us as our sisterhood or our tribe because this is where we bond together about our lived experiences. And we want to make sure we reduce the health disparities and isolation and stigma that really goes around cervical cancer. Cervical cancer is a gynecologic cancer, and we all know that a lot of patients don't like to talk about it because it's below the belt. It's a taboo. And so we want to make sure that we remove that stigma so people are talking about it. As we talk about it, that helps raise awareness. You might ask yourself, what does Survivor do? And so again, we try to build a community of support. That's the foundation. We want to make sure that patients and survivors feel that support amongst each other. So we do that through support groups. We do that online. So virtually we'll have meetings once a month. for patients to attend. We also have a caregivers group as well for patients, for caregivers who are trying to understand how to provide that care for their loved ones. So that's something else that's a core part of what Survivor does. We also, as we said, with the advocacy and education, we have Survivor School where we train through education programs survivors to speak publicly. I went through it back in 2022, and it has really helped me and hone my message and be able to speak, especially at these, invited events. Sometimes I've given TV interviews, things like that, to really help advocate and provide awareness for others. The other part again is sharing stories. A part of one of my achievements, and I feel like a big accomplishment, is to be able to do the podcast. So I am Survivor podcast host, where we invite survivors to share their story on different topics and to really educate. Some of it, one great topic we had a couple years ago was sexual health. How do we talk about sexual health after cervical cancer? No one wants to talk about sexual health after cancer. And a lot of patients want to talk about it, but they just don't know how to talk about it with their doctors or their family or their friends. And so this was a great avenue to really share that story and be able to provide that information back. The other part that we do is also volunteer and outreach. So we partner with various community outreach programs to increase awareness, whether it's at health events, we'll have a booth, whether it's at helping with vaccine drives, things like that. And so, or screening drives, especially now with the new FDA approved screening tool for I think it's in-home and at clinic screenings. That's something else that we advocate and also outreach in the community. So these are things that we as a Survivor hold dear, and we also act on in our organization. We also partner with and collaborate with a number of public health and advocacy groups such as WHO, the National Cancer Institute, American Cancer Society, and others, and the Moonshot Initiative. And this is our founder, Tamika Felder, who was speaking at the Cancer Moonshot Initiative during the last administration. And really, we might ask why Survivor matters, and Survivor really plays a unique role. It doesn't just connect survivors and patients worldwide. We have members all over the world, but we also like to translate those lived experience and those shared stories to help in, that powerful health, public health messaging and help advocate and empower those patients. We train leaders within the community, and we also help amplify those voices that are really missing in healthcare. And policy spaces. So we have a number of patient advocates in Survivor that are willing and able to help speak on any type of conversation or topic around cervical cancer. You might have heard, in the 2-minute spiel, the video earlier of my story, but I wanted to be able to provide that personal experience with Survivor. So, I was diagnosed at 18 with HPV. And my original doctor, OBGYN, just kind of dismissed me. She just said, you're 18, you're fine. Don't worry about it. Come back for a year checkup and you're fine. And around that time in 2002, there was a lot of information, a lot of publications coming out about HPV linked to cervical cancer. And as a college student, I went to my, college library and started doing some research on HPV and discovered that there are certain strains, high grades, that are linked to cervical cancer. And that's where I went back to my doctor, printing out those articles and showing her. She had, dismissed me, and that's when I got a second opinion. And that second opinion resulted into closer monitoring. And then when I was 22, I was diagnosed with cervical cancer. And so I feel like that type of advocation for myself really saved my life, or else I would have been kind of oblivious to the whole thing. But it's important to understand that at that 2006 mark, when I was diagnosed, the HPV vaccine was released. And I was out of that age group of the HPV vaccine, so I was never able to get it. But, unfortunately, my daughter did get it, and so I'm really proud of that. But, the thing is that I said in that video, it doesn't stop, right? My life continued. I tried to continue my life and try to have my daughter and and move on with my marriage. But again, you forget that cancer is still there. It's still in the background. No matter how much you try to move on, it's still there. And it did eventually come back, and I had to get a hysterectomy and some further treatment on that. But the part of that survivor kind of got into there was because I realized that I couldn't fight this alone. I had to, I needed a group. I needed a support group there to help me through a lot of the obstacles that I was going through. And so that's where I, partnered with Survivor. I went to Survivor School, and it gave me some purpose in life. And that was the thing that I credit Survivor to. It gave me that purpose, a voice and a purpose for my story. And so I now host the Survivor podcast and really try to help others through this process. So I just, just as a short message, just a reminder, and part of the advocacy and part of the awareness, today is in the US, approximately 13,360 people are diagnosed with invasive cervical cancer, and about 4,320 will die from this disease. And that's according to the ACS in 2025. So that's with the vaccine and the screening, that's 4,320 patients that don't need to die from this. They got the vaccine, if they got the screening, and if caught early, they can live a normal and, a long life. And I think that's the number that sticks with me, that if I don't continue to fight and we don't continue to do our job, that 4,320 lives are lost. And that's just in the US. That's not including around the world. And Australia is on track to eradicate cervical cancer. And that's something that is a huge accomplishment. And if Australia can do it, I don't see why the US can't do it. So, I just wanted to leave that message there. This is a slide that has all of our contact information, whether it's through Instagram, Facebook. We have a push this month for Cervical Cancer Awareness Month. We are having a summit later this month in DC, which will be held live and virtually, so in person and virtual. We have a number of social media campaigns running right now. So if you check out our Facebook or Instagram, you'll see those campaigns going. And so, yeah, so thank you very much. I don't want to, take up too much time. I know you have a packed agenda, but if you have any questions, please feel free to ask or put in the chat.
Awesome. Thank you so much, Jocelyn, for sharing your story through the video as well as through your slide presentation and just bringing it all together into life. We do have one question that just came in on the chat. I don't know if you can see that or if I need to read it regarding global cervical cancer community.
Oh, yes. Do you find the global cervical cancer community has similar governmental challenges? It depends. I think they're more open, right? The UK and other countries are looking at the one shot. So, and they're more kind of progressive because I think you see that it can be eradicated. The term eradication is in our future. And so a lot of countries are pushing towards that, and a lot of times, I know, in the medical community, it's hard to when you can say that you can cure somebody from cancer, right? But this one, we have a vaccine, we have screening methods, we now have an at-home and in-clinic, screening that makes it easier for patients. So I think other countries are really pushing that envelope to say we really need to eradicate. This needs to be a forefront. WHO has put it as their forefront initiative. So I think globally it is a little bit more forefront in that. US, I think with the administrative policies that they have and their rhetoric right now, I think is very much different.
Okay.
Yeah,
Gary, I think you have a question.
absolutely. Thank you for your answer because I'd like to follow up on my earlier question. Do you find that the current administration is hindering research and say vaccine policies or things of that nature with regards to cervical cancer? And I know Kennedy has a anti-vaccine standpoint, but where do you see that as being a hindrance or is it?
Yeah, these are definitely my opinion. I just want to point that my total opinion on this. But yes, we haven't seen that the administration has backed away from the HPV vaccine, but I know the way that the trend is going, that could be a possibility. I think, if we're talking about research, and uniquely, I am a publisher, so I work with the research community. And I think you are, in that statement, yes, I do feel personally that it is hindering the work that has been done. The previous administration, this was a priority, per the Cancer Moonshot Initiative, because it was in reach, right? We saw that cancer, cervical cancer eradication was in our reach. And I think everyone in that previous administration took that to heart. It is a priority. This administration, I think, with the cuts in research and funding, and also their stance on vaccines, I think has hindered it. However, I do want to point out that recently with the FDA approval with that at-home test could be, it's that balancing act, right? They're stepping back on a lot of things, but I'm hopeful to see that was approved. The other thing I am hopeful is globally, looking at different opportunities and options to help with this eradication could help with that as well. So if we see other parts of the world doing their part in this, hopefully maybe the US might step up. But right now we're kind of in that state of I don't know what's going to happen. I hope that answers your question.
Yes, thank you.
All right. Thank you so much. I do not see any other hands raised or questions. I'll give people a moment if someone wants to raise a question or make a comment, but I did want to call out a couple of things that you had mentioned. And one was the upcoming summit that you're going to be having later this month, and just to encourage the group to visit the Survivor website so they can gather information about how to participate in that session, either virtually, because I believe it was going to be held back in DC. So please, I want to encourage the group to do that and to make sure we share that with our networks. Also, I would like to encourage the group to take a look at the social media handles that were provided in the slide, as well as if you go to the Survivor website, you can actually help amplify those messages that are already out there through your own social media channels. And then is there a way or information, would that be available on your website as well, about how people can either listen to the podcast, or if someone would like to get involved, or if they know someone who'd like to get involved with your organization, they can do that all through the website?
Yes, definitely. It's through the website, but I'll also put my information on the chat as well, and some of the links, so that way you can access that. But yes, the podcast and everything is available on Spotify, Apple. But if you have any questions, please feel free to reach out to me. I'm happy to address that.
Great. Well, thank you so much for sharing part of your time with us today and sharing your story and about the organization. And we look forward to being able to come alongside and amplify some of those shared messages and resources with our respective networks. So thank you again, Jocelyn.
Thank you.
And I also want to call the group's attention to the chat. There's been some additional resources added from our partner Murnell. So please take a look at those and capture those links. And hearing that there are no other questions related to Survivor, go ahead and capture those links that Jocelyn just populated in the chat. And thanks, everyone. So going to move forward here. Just again, some of the key messages that came out. of that related to cervical cancer screening and HPV testing that should go ahead and help amplify those messages, as well as the messages that are a part of the survivor website. And then also a challenge for everyone, and that is that the American Cancer Society has a cervical cancer quiz. So we'll put that link in the chat. It'll give you an opportunity to kind of test your knowledge and see what your score is and see where you stand and where you may or may not benefit from learning a little bit more about cervical cancer. So please take a look at the chat and capture that link for the cervical cancer quiz, and remember the survivor website. So now we're going to move into our announcements, and starting with some of the ones that we received directly. There will be a community and patient advocate training coming up around cervical cancer on the 15th of this month. If you have your phones, please go ahead and scan the QR code for the link to register for that. The California HPV Vaccination Learning Collaborative, they will be meeting on the 21st. That's also another opportunity, another way to network around HPV vaccination and cervical cancer screening in general. Please check the chat for the link to that upcoming Zoom session. And then we also received from some of our UCSF colleagues information about a prostate, although not a prostate cancer journal club for patients. They're doing a Zoom webinar series that's also on the 15th. That link and that information is also in the chat. And then, of course, our Wisdom colleagues at UCSF are always wanting to encourage folks to join their community forum the last Monday of every month.